Respiratory therapist. This patient needs a PRN treatment.
Why does he need a PRN treatment?
Because I heard him cough.
You heard him cough?
Yes. I heard him cough while he was sleeping. Will you give him a PRN treatment?
There are no respiratory treatments ordered for him. I cannot give a PRN treatment without an order.
Okay. I order you to give him a treatment.
It doesn't work that way.
Why?
Because a doctor's order is required to administer respiratory treatments.
Why do we need a doctor's order?
Because if the patient dies during the treatment, we can blame it on the doctor for ordering it in the first place.
Will you call the doctor and ask him to order breathing treatments on this patient?
I will not call a doctor at 2 in the morning because you heard a patient cough in his sleep. Did you listen to his breath sounds?
No, I cannot listen to the doctor's breath sounds if he is not here.
I meant the patient.
No. How do you listen to breath sounds?
You use a stethoscope.
Is that what you use it for? I thought it was a fashion accessory when I saw my favorite actress on Grey's Anatomy carrying one.
Do you know this patient's diagnosis?
Yes.
Well?
No, he is not well. He is sick. That is why he is in the hospital.
Does this patient have a history of asthma?
No.
COPD?
No.
Congestive heart failure?
No.
Lung cancer?
No.
Cystic fibrosis?
No.
Pulmonary fibrosis?
No.
Sarcoidosis?
No.
Asbestosis?
No.
Tuberculosis?
No.
Bronchopulmonary dysplasia?
No.
San Joaquin Valley fever?
No.
Legionnaire's disease?
No.
H1N1?
No.
HIV?
No.
Alpha-1 antitrypsin deficiency?
No.
Do you have a functioning neuron in your skull?
No. This patient also needs a stat incentive spirometer. I think he is getting pneumonia.
Why do you think he is getting pneumonia?
He might have a fever.
Did you check his temperature?
How?
With a thermometer?
I do not like touching patients. They are yucky and gross.
Then why did you become a nurse?
Because I look really cute in pastel-colored scrubs.
A fever is not necessarily indicative of pneumonia.
His oxygen saturation dropped from 98% to 95%. He is deteriorating and will soon code if you do not administer a stat incentive spirometer to this patient.
I think I would rather give him the Easter Bunny and a fuel-efficient Humvee instead.
But the Easter Bunny and a fuel-efficient Humvee don't exist.
Neither does a stat incentive spirometry.
So what will you do for this patient?
I will call the EEG technician.
Do you think his problem is neurological?
Yes.
What is the problem?
I suspect that he has a brain deadness.